The benefit of steerable technology is that it makes you look like an expert every time. We all like to think that we can place our devices on the mark each and every time, but the fact is sometimes there are physiologic factors that are working against us.
When I think of steerable technology in spine ablation, I think it's a must. The anatomy of the spine is such that if you put a straight needle in, you're really going anterior to posterior. And what we've seen in spine metastatic lesions, the failures are in the central posterior portion, whether it's radiation oncology or even surgical cases where they've done partial corpectomies. That's where the failure is.
With steerable technology, you can use the easier transpedicular approach most of the time, because once you make access into the vertebral body after you pass that posterior margin and you're in that area of safety, you can direct by steering the needle where you want it to go. Unlike the straight technologies or even the pre-curved non-steerable techniques, you have to adjust from the beginning.
The other area where steerable technology is valuable is, vertebral body heights, especially in cancer where there's maybe only minimal fracture, are not 3 by 2. If you look at the average lumbar vertebra, it's well over 3 by 2. So being able to navigate and make a new ablation zone is definitely a benefit of the technology.
I decided to change to the steerable technology because I found it to be a lot of times easier to get into the area that I needed to. It allowed me to take a unilateral approach, which I have found with patients post-op pain is markedly less when you're doing a unilateral approach, and a lot of times a shorter procedure time.
So using steerable technology hasn't really changed my practice. It's grown my practice, and I've used multiple devices over the years, none purpose-built directly for the spine that had steerable technology. They were all straight needles.
Early on, when I was experimenting with ablation in the spine, we had very few devices available. They were straight, rigid probes. They were unipolar devices. As soon as the Star Ablation probe became available on the market, I converted my entire spine ablation practice to this device. There is nothing else like it. The ability to perform a bipolar ablation with a navigational device is a game changer.